Now I am delighted to be joined by CEO and Medical Director of APA, Dr. Saul Levin. Dr. Levin, thank you so much for your time today.
My pleasure. Thank you for doing this for the annual meeting.
Well, as you are well aware, we have been living through a tumultuous time this past year, and it's been a very difficult year for many people. How has the COVID-19 pandemic impacted mental health, and what are the key challenges facing the APA community as a result of this pandemic?
Well, thank you. You're right. The pandemic has caused upheaval across the globe. It's not just the United States, it's every country. And I've been saddened by the pandemic response in this country up until the beginning of this year, where things have clearly begun to move in a really positive direction. But I think my sadness, in particular at the beginning of the pandemic, was that healthcare workers were forced to provide their own PPE, which was a major failure in this country. It should have been the national government coming out with PPE, not asking the individual practitioners and psychiatrists and physicians to provide their own PPE. The cost of the virus has also been tremendous, both financially and, more importantly, to the loss of human life. And it has really put a spotlight on the inequities of the American healthcare system, and particularly the BIPOC around social determinants of health disparities. Physician leaders of the next 10 to 20 years are going to be working within and fighting to improve an American healthcare system that has serious issues, particularly where mental health is concerned. COVID-19 has really driven home the seriousness of the physician and psychiatrist shortage within the United States.
So can you outline the APA's advocacy work to address these challenges in mental health?
Thank you. Good question. APA advocates on behalf of all its members and their patients. Psychiatrists are here to take care of patients that they serve. On a variety of fronts, we've really led our advocating around mental health, raising awareness of psychiatric issues, and fighting the battles that matter most for our profession. Right now, we're focusing on the access at the federal level in ways that connect patients to care and coverage, address the inequities of healthcare, particularly around mental health and substance use disorders, and invest in mental health and substance use disorder services.
So how can APA members get involved in this advocacy work?
So APA members are involved at two levels. The first is starting at the state level through their local district branches, or at the federal level in a variety of ways. I encourage everyone to stay up to date on our activities by subscribing to the advocacy alerts that the Division of Government Relations does, and you can find that also at psychiatry.org/advocacy. And you can become a member of our Congressional Advocacy Network called the CAN, where we ask you to really get to know your representative or your senator, because personal relationships with all interactions, particularly us as psychiatrists, know that that's where you really ensure that your points of view and your experiences are carried into the legislature.
Well, let's end on a high note. What are some of the achievements that have been made this year in mental health and in advocacy, despite all of the adversity we have experienced?
So I think the first real positive achievement for us was telepsychiatry. As psychiatrists, we're used to sitting one-on-one with our patients or with family members and our patients or kids and their parents. But telepsychiatry has been something for what some would do, particularly around rural areas. But the pandemic really showed that we had to, in order to meet the needs of all our patients, we had to increase our access to care for those patients in telepsychiatry. Many requirements for practicing telepsychiatry is limited by access who cannot travel or lack broadband internet access or video capacity. And these were relaxed by the Center for Medicaid and Medicare Services as part of the COVID pandemic. That really opened up the field for every psychiatrist to be able to do telepsychiatry. And it has really helped us, particularly in No-shows drop tremendously if you do telepsychiatry, and better adherence to medications. And I think also better continuation of therapy overall is one of the real positives on it. The next part is parity. We took a huge step forward on parity this December. The Congress passed a massive Appropriations Act, which included $4 billion, which will help people with mental illness and substance use disorders. As part of the law, it also gave, more importantly, the Department of Labor new regulatory authority to hold insurance companies who are discriminating against people with mental illness accountable. In primary care, they were able to do it. They weren't able to do it around mental health. Now they can. That law is a game changer for psychiatrists and their patients. And it was the signature APA legislation that we backed at first in the states and then brought it to the Congress. And it was in part due to the advocacy of every one of our members, to Dr. Jeffrey Geller, our current president, who gave testimony on the Hill, and to the hard work of our staff that this legislation was passed.
Wonderful achievements in this past year. Dr. Saul Levin, CEO and Medical Director of APA, thank you so much for your time today. Appreciate it.
Thank you very much.